the causes of mechanical small bowel obstruction are traditionally divided into three categories: luminal causes, mural causes, and extramural causes. And this is a reasonable list of causes under each category that you may wish to memorize. I promise that by the end of this session, all of those will make sense. Now, imagine this is bowel. We've got bowel wall, bowel lumen, and stuff outside the bowel wall. So the first category of causes of mechanical small bowel obstruction is luminal causes. That means causes within the lumen of the bowel, so inside the sort of empty central part where food normally is contained. The second category is mural causes, so causes within the bowel wall itself. And the final category is extramural causes, so causes that are outside the bowel wall. So luminal, mural, and extramural causes. Just as a brief bit of revision, small bowel obstruction is when the contents inside the jejunum and ileum can't go through and are blocked, and it's divided into mechanical and functional. And this video is focused on mechanical small bowel obstruction, which implies the presence of a physical transition point through which the contents cannot pass. So these are the three categories of causes of mechanical small bowel obstruction. Let's focus on the luminal causes first, so causes that are here within the bowel lumen itself. Here's a reasonable list of causes for you to remember. So food bolus, foreign body, and gallstone. So if you eat something that cannot be digested very well, or food that is poorly masticated, that could cause a small bowel obstruction. A foreign body, like a large marble or a coin or something like that, could block the lumen. And a gallstone, so if you develop a cholecystoduodenal fistula, you could have a gallstone that passes from the gallbladder into the duodenum, and as it goes through the small bowel, when the small bowel naturally gets narrower as you progress from proximal to distal, it can lodge somewhere and cause bowel obstruction. The next category is mural causes of bowel obstruction, so causes of bowel obstruction that are found in the wall of the bowel. Here's a reasonable list of causes. So neoplasia, so malignant or non-malignant tumors, growths rather, and inflammation. So for example, Crohn's disease can cause inflammatory strictures. Fibrosis, so inflammatory strictures can become fibrotic, and then ischemic strictures. So for example, if for some reason your small bowel undergoes ischemia, you can develop ischemic strictures, which can also cause small bowel obstruction. Now let's move on to extramural causes. These are some of the more common causes of bowel obstruction. So even though they are listed last, they are by no means the least. So adhesions being the commonest cause of small bowel obstruction. About 60% of small bowel obstruction is adhesional. Then hernia, which can be internal or external hernia. So external hernia being the more common type. So hernia through a natural orifice or an iatrogenic orifice. So inguinal, femoral, paraumbilical, incisional, or hernia through the lumbar area or just lateral of the rectus abdominis muscle. Then you've got intussusception. We should also mention internal hernia. So after procedures like, for example, a Roux-en-Y gastric bypass, which can create these internal hernial orifices. If they are not closed, they can cause hernia. Then we should talk about intussusception, so the telescoping of bowel within its own lumen, often associated with a pathological lead point. Volvulus, which is the twisting of bowel on itself. And tumor, so any sort of swelling, whether benign or malignant, inside the abdominal cavity can extrinsically compress bowel and cause a transition point and therefore cause mechanical small bowel obstruction. So that is the list of the causes of mechanical small bowel obstruction divided into these pathophysiological categories, or pathoanatomical even. So it's easiest to remember it this way, because instead of having to remember a list of 12 causes, you remember 3 lists of 3 to 5 causes. And personally, I find that easier. And this is the traditional way that the causes of small bowel obstruction are taught within surgery. So luminal, mural, and extramural causes. This list is probably not exhaustive, but it's a very, very reasonable list to start with. And it is a list that will probably help you with exams. Thank you for watching, and please subscribe to my YouTube channel for more content like this. I'm going to continue this series on small bowel obstruction every day that I can. My name's Arrow. I'm a core surgical trainee, and I'm teaching you what I know about surgery. And quick legal disclaimer, this is not medical advice, educational only. And this is not a replacement for guidelines, evidence, policies, or senior supervision, so don't use this video to treat your patients. And I make this video with no institutional or NHS affiliation. These are the resources that I read in preparation for this presentation. Thank you for watching. Bye-bye.